On May 28, 1902, a 23-year-old French woman named Marie Bély was carried off a train at Lourdes. 3 physicians agreed she was hours from death from tubercular peritonitis. One of them was Alexis Carrel, a young agnostic surgeon from Lyon. 10 years later, he would win the Nobel Prize in medicine. Carrel watched water from the spring poured over Bély's distended abdomen. The swelling receded. By that evening, she was eating. The next morning, she walked. Carrel could not explain what he had seen. Neither could anyone else. This is one of more than 7,000 cases recorded at the sanctuary of Our Lady of Lourdes since 1858. Tonight, we examine 9 the medical record cannot account for. The Lourdes Medical Bureau was created in 1883. To declare a cure medically inexplicable, the International Medical Committee, around 30 specialists from multiple countries, including non-Catholics, must agree by a 2/3 majority. The illness must be severe and confirmed. The recovery must be instantaneous, complete, and lasting. Of 7,000 reported cures, only 72 have passed. Every patient was diagnosed by physicians. Every cure was tracked over years. None has a complete medical explanation. Number 9. Catherine Latapie. In October 1856, while gathering acorns near the village of Laubajac, she fell from an oak tree. The fall tore the brachial plexus, the bundle of nerves that controls the arm. 2 of her fingers were left permanently paralyzed and contracted. The damage did not improve. On the night of February 28, 1858, only 17 days after a 14-year-old peasant girl named Bernadette Sauberus reported her first vision in the grotto at Massabielle, Latapie walked the 7 kilometers to Lourdes. She dipped her paralyzed hand in the spring water. Her fingers uncurled. She returned home and gave birth to her 3rd child later that day. Her case was recognized in January 1862 by Bishop Bertrand Saver Lawrence of Tarbes. The first of the 72. Traumatic brachial plexus injury with established muscle wasting does not spontaneously reverse. Hers did. Number 8. John Traynor, known as Jack, a British sailor from Liverpool. At Gallipoli in 1915, machine gun fire severed his right brachial plexus. A 1920 attempt to relieve his epileptic seizures by trephining the skull left him partially paralyzed in both legs. By 1923, he was certified by the British Ministry of Pensions as 100% disabled. The right arm was scheduled for amputation. In July 1923, he traveled to Lourdes against medical advice. 5 days later, he walked back to his hotel. The seizures stopped. The arm regained strength. Here is the strange part. The British Ministry of Pensions never reclassified him. They continued paying his full disability pension because, on paper, the underlying skull defect and nerve damage were still present. The cure did not undo the wounds. It restored function the wounds should have made impossible. The case was certified by the Bureau in 1926. Formal church recognition languished for almost a century. On December 8, 2024, Archbishop Malcolm McMahon of Liverpool declared the cure the 71st officially recognized miracle of Lourdes, 101 years after it occurred. Number 7. Anna Santaniello, born 1911 in Salerno, southern Italy. As a child, she contracted rheumatic fever. The infection scarred the valves of her heart. By her 30s, she could not walk without becoming breathless. Her lips and fingers were cyanotic. 2 of her siblings had already died of the same condition. On August 19, 1952, at age 41, she was carried by stretcher into the baths at Lourdes. She walked out. The cyanosis was gone. The breathlessness was gone. She lived another 53 years. Her case was reviewed by Italian and French cardiologists across more than 5 decades and formally recognized in September 2005 by Archbishop Gerardo Pirro of Salerno. She was alive at the announcement. She was 94. Number 6. Serge Perrin, a 41-year-old French printer from Lyon-Dangers. From 1964, he suffered a series of strokes, recurrent right-sided hemiplegia caused by bilateral carotid artery insufficiency. By 1970, he had lost most of the vision in his right eye and could no longer walk unassisted. On May 1, 1970, during a pilgrimage to Lourdes, strength and vision returned during the anointing of the sick. He worked normally for the rest of his life. His case was recognized in June 1978 by Bishop Jean Orchampt of Angers. We include Perrin precisely because his case has been challenged. The American skeptic James Randi, in his 1987 book The Faith Healers, argued that Perrin's symptoms were more consistent with hysteria than with vascular disease, since the diagnostic tools of 1970, pre-MRI, could not definitively rule it out. The Bureau's response was that the symptoms persisted for 6 years, did not respond to emotional triggers, and were observed by multiple independent neurologists. The Bureau does not declare miracles. It declares the absence of a current medical explanation. The two are not the same. Number 5. We return to the woman from the opening, Marie Bély, born 1878. Both parents died of tuberculosis. By 1901, she was dying of tubercular peritonitis. In March 1902, surgeons in Lyon refused to operate, fearing she would die on the table. On May 25, friends smuggled her aboard a pilgrimage train forbidden to carry the dying. Alexis Carroll, the young surgeon attending her, told a colleague she would not arrive alive. She did. At the grotto on May 28, water from the spring was poured over her abdomen 3 times. The hard masses softened. She asked for milk. She entered the Sisters of Charity novitiate that November and lived as a nursing sister, without relapse, until her death in 1937 at the age of 58. Carroll published a defense of the cure that ended his career at Lyon. He emigrated to North America and won the 1912 Nobel Prize in Medicine for his work on vascular suturing. The Bély case is not among the 72. Carroll never formally submitted it. A reappraisal published in the American Journal of the Medical Sciences in late 2025 by Matthew Ginier Gillett and Alessandro de Franciscus, drawing on previously unpublished Carroll notes from the Lourdes archives, concluded the diagnosis cannot be definitively settled even now, though tubercular peritonitis remains the most consistent reading. Number 4. Danila Castelli, from Berigardo near Pavia, born 1946. Beginning in 1980, she suffered from sudden, life-threatening hypertensive crises, episodes of malignant blood pressure spikes that could kill within minutes. The diagnosis, after years of investigation, was a paraganglioma, a rare tumor that secretes adrenaline-like hormones in unpredictable bursts. The primary tumor was surgically removed. The crises continued, suggesting metastatic spread. By 1989, she was on the edge of cardiovascular collapse. On May 4, 1989, during a pilgrimage to Lourdes, she bathed in the spring water. The hypertensive crises stopped that day. They never returned. Subsequent imaging revealed no evidence of remaining tumor. The case was reviewed for more than 2 decades and recognized in June 2013 by the Bishop of Pavia. Paragangliomas, when metastatic, are not known to spontaneously regress to undetectability. Hers did. Number 3. Vittorio Micheli, a 23-year-old soldier in the Italian Army's Alpine Corps. In April 1962, X-rays at the military hospital in Verona showed osteolysis, the destruction of bone, involving the ilium and the roof of the acetabulum, the socket of his left hip. A biopsy returned cells consistent with sarcoma. The bone had been so thoroughly eaten away that the head of his femur was no longer attached to his pelvis. It dangled. Surgeons did not operate. There was nothing left to operate on. In May 1963, racked with pain and unable to walk, Micheli was lowered into the baths at Lourdes, still in his plaster cast. Within weeks, the pain was gone. Within a month, he was walking. Subsequent radiographs, taken over the following 9 years, showed something never described in the orthopedic literature. The acetabulum had reformed, slightly displaced with faint scarring but functional, weight-bearing, and pain-free. The case was published in the Linaker Quarterly in 2013 by Barbara A. Nealon, drawing on the original Bureau report by Professor Mitchell Marie Salmon, presented to the International Medical Committee in May 1972. The cure was recognized in May 1976 by Archbishop Alessandro Gottardi of Trento. Micheli is alive as of recent reporting. The reconstructed hip has held for more than 60 years. Number 2. Jean-Pierre Bély, a French anesthesia and intensive care nurse, meaning his diagnosis, when it came, was one he understood clinically. In 1972, he began to lose neurological function. By 1985, he needed a wheelchair. By 1987, he was bedridden, classified by the French Health Service as 100% disabled, with multiple sclerosis confirmed by his neurologist at the University Hospital of Poitiers. He was 51. In October 1987, his fellow pilgrims expected him to die during the trip to Lourdes. On October 9, during the anointing of the sick, he felt warmth move through his body, beginning at his toes. He took his first steps that night. By the end of the pilgrimage, he walked unaided to the train. He lived another 28 years. His treating physicians, including Dr. Patrick Fontenot, described in the medical record as agnostic, found no remaining clinical signs of multiple sclerosis. The Paris neurologist Catherine Lubetsky, who reviewed the case, said publicly that in her entire career she had never witnessed a recovery this complete. The cure was declared inexplicable on November 14, 1998, and proclaimed miraculous by Bishop Claude Dagens of Angoulême in February 1999. Multiple sclerosis can remit. It does not undo 15 years of accumulated demyelination overnight. Number 1. Antonietta Raco of Francavilla Incini in southern Italy, born 1957. In 2004, she developed severe headaches and progressive weakness. By 2005, she could no longer swallow normally or speak clearly. In 2006, she was diagnosed with primary lateral sclerosis, a rare motor neuron disease related to ALS, in which the upper motor neurons progressively die. There is no cure. The condition is, in the words of the senior neurologist who reviewed her case, Professor Vincenzo Solani of the Oxologico Institute in Milan, one in which patients are doomed to get a little worse every day. By 2008, Raco was effectively quadriplegic. From July 30 to August 5, 2009, she traveled to Lourdes with the Italian pilgrimage organization UNITALSI. In the baths on July 31, she felt her legs taken from her, her own description, followed by warmth. She did not tell anyone. She remained in her wheelchair for the rest of the pilgrimage. That evening of August 5, in her own living room in Italy, she stood without help for the first time in years. The next morning she walked. Medical follow-up confirmed every neurological deficit had disappeared. Her case was reviewed by the Bureau across 15 years. In November 2024, 21 members of the International Medical Committee voted by secret ballot. 17 voted that the cure was unexpected, complete, lasting, and unexplained. On April 16, 2025, Bishop Vincenzo Carmine Orofino of Terzi Lagonegro proclaimed the cure the 72nd officially recognized miracle of Lourdes. Antonietta Raco is alive. She volunteers each year at Lourdes, carrying stretchers for the pilgrims who arrive as she once did. 72 cases in 167 years, out of more than 7,000 reported. The International Medical Committee of Lourdes does not declare miracles. It declares the absence of a current medical explanation. The distinction matters. In each case we examined tonight, the diagnosis was confirmed by physicians, often non-Catholic, sometimes openly skeptical. The recovery was instantaneous. The follow-up extended for years, sometimes decades. And in each case, what remains is a question. Is there a biological mechanism medicine has not yet identified? Is the immune system, under certain rare circumstances, capable of regression we have not learned to induce? Or does the human body, every so often, simply do something we cannot follow? The Lourdes archives are open to qualified researchers. The data is there. What is missing is the explanation. If you are interested in the parts of medicine the textbooks have not yet caught up to, subscribe.